Hello everyone, how are you today? Welcome to my channel. I'm Dr. Paramjeet, and those who don't know me, I'm a consultant physician cardiologist in Yashoda Superspeciality Hospital, Nehru Nagar, Ghaziabad, Delhi NCR. And this is my channel. Here I make videos about health and healthcare topics, and I give you simplified medical explanations about the most common health concerns. And this information which I provide with you, it is the most recent and authentic referenced data from the US International Medical Health Library, and therefore you can trust the information. There are so many videos already made on my channel. You can go out, browse, check them out, and if you like the videos, then don't forget to hit the bell icon and subscribe my channel so that you can receive the notification of the next upcoming video whenever I upload it. So today's topic, guys, is polycystic ovarian disease, polycystic ovarian syndrome.
If you want to know about health and have health concerns, then subscribe to my channel and hit the bell icon. You'll be notified about all upcoming videos.
PCOS. PCOS or polycystic ovarian syndrome is a condition in which a woman has an imbalance of her female sex hormones. And all the problems of this syndrome are because of these hormonal imbalance. That is the basic reason, the cause behind the problems. Now, because of these hormonal imbalances, all the issues happen. There might be issues in your menstrual cycle, in the ovaries where cysts, water-filled bubbles can form. There might be trouble getting pregnant, and there might be many other health problems. Now what happens? Because of these hormonal imbalance, the ovaries are unable to produce fully grown and mature eggs. It becomes difficult for the ovaries to produce and release fully grown mature eggs. Now, the reason for all these problems, why the hormonal issues occur, is not very well understood. But the hormones which are affected are the female sex hormones, estrogens and progesterones, which becomes less because these hormones are required for the female women's ovaries so that they can produce and release eggs. Then the second hormone which has a problem are androgens. These are predominantly the male hormones, but they are also produced in women in a small amount. And what happens if there is an imbalance? If these are produced in a larger amount in a woman instead of a small amount, and estrogen progesterones are less, then their problem happens. Then the patient develops polycystic ovarian syndrome. Normally, one or more eggs are released during a woman's cycle. This is known as ovulation. But in polycystic ovarian disease, this egg, even if it is maturing inside the ovaries, is not able to release. They stay inside the ovaries, and therefore there can be accumulation of many of them, causing polycystic ovarian disease. Now, this problem with the release of the egg can lead to infertility. Most of the time, this issue of polycystic ovarian syndrome is diagnosed in a woman of 20 to 30 years of age in the early gestation periods. But it may also be found in teenagers as well, especially if they are having a problem with their menstrual cycle. Now, in that case, the symptoms often begin when the girl starts her period. Most of the time, it is often seen that if you are facing this problem, that some female in your family, your mother or sister, does show similar problems as well. So there might be a genetic relationship of this issue as well. Now let's understand what are the symptoms of polycystic ovarian disease. First of all, like I said, there are symptoms of menstrual cycle. So first, not getting a period after you have had one or more normal periods. If suddenly you stop getting period after a couple of regular cycles, then second is if you are having irregular periods that come and go, and they can be irregular bleeding. Some might be light, some might be heavy. So these are the period issues, menstrual cycle symptoms which you might show. then there can be other symptoms as well. There can be, because there is higher amount of androgens present, which are the male hormones, so there will be extra body hair which grows on your chest, on your belly, on your face, around the nipples. Then there can be acne on the face, on the chest, on the back. The skin can get darker, thicker because of the androgens, and there can be skin markings and creases around the armpits, the groins, the neck. There can be even problems around the breasts. These are basically development of male characteristics, but this is not always a typical finding. That means if they are not present, it does not mean that you do not have PCOS. What it means is, if male hormones are present in a very high amount, then these changes will definitely present. But if female hormones are less, then also you can have PCOS or polycystic ovarian syndrome issues. Then other changes about from skin and neck and breast, other changes can be, you can have thinning of hair on the head or the temple. You might have male pattern baldness. There can be enlargement of your clitoris around your vagina. Then deepening of your voice or decrease in your breast size. This can happen. So let's understand, all these things are happening because of hormones. So these are all the symptoms of polycystic ovarian disease. Let's understand how we diagnose a patient with polycystic ovarian disease, what tests are done on you when you go to a doctor. When you go to a doctor, obviously after a physical examination and a detailed history, your doctor may do a pelvic exam, and which may be done to check whether there is any swelling in the ovaries. In the pelvic exam, if you have a polycystic ovarian disease, exam may show swollen ovaries which might be palpable. So swollen ovary is one sign. Sometimes it is there, sometimes it's not. Then we take a detailed history, past history. We check for presence of other health conditions which are commonly seen associated with polycystic ovarian syndrome. These include diabetes, high blood pressure, high cholesterol, weight gain and obesity. Ideally, your body weight and body mass index (BMI) should be measured, as well as your belly size. Abdominal size is also measured. Then there are a series of blood tests which are done. Obviously this problem is because of hormonal imbalance, so hormone levels will be done. Hormones include estrogen, FSH, follicle stimulating hormone, luteinizing hormones, LH, then testosterones, and sometimes 17 keto steroids are also done. Then apart from hormones, other blood tests which can be done include fasting sugar, and sometimes we also do glucose tolerance tests or insulin resistance tests, then lipid profiles, pregnancy tests, serum HCG is very important, then prolactin levels, thyroid functions. The doctor may sometimes go for ultrasound imagings like vaginal ultrasound, pelvic, even sometimes we do pelvic laparoscopy. So these are imaging studies or tests which show us in which we can actually look at your ovaries, whether they are swollen or not, whether they have any cysts present inside them or not. Cysts are basically bubbles filled with fluids. So all these are the tests which we do. Once we diagnose that there is a hormonal imbalance, there is a swelling in the ovaries, there are small bubbles, polycystic ovarian disease, then how do we treat it? See, most of the polycystic ovarian disease patients are either obese or they gain weight very fast. In such patients, losing weight, even if it is a small amount, can help a lot in the treatment and can bring about a change in the hormone levels. So first step is to start losing weight. Second, diabetes has to be managed, high blood pressure needs to be managed, high cholesterol needs to be managed, thyroid functions needs to be managed. So all these predisposing conditions which contribute to these problems needs to be managed. So all these things, to manage all these things, I have made separate videos. in my channel, so you can go and check these videos to understand these problems individually, and then you can manage these problems by understanding the problem as well as the solution. Then apart from these, your doctor can also recommend birth control pills, contraceptive pills, to make your periods more regular. And these medicines can also help reduce the abnormal hair growth or the acne or all the male characteristics which you are developing. But this changes will happen only after you have taken these pills for several months. So if you are diabetic, then your doctor will prefer a drug called metformin, so which also helps in making your periods more regular, preventing or helps you lose weight. Then other medicines which can be prescribed to you so that your periods become regular and so that you can get pregnant are hormones. In this we use LH releasing hormones, luteinizing hormone releasing hormone analogs, LHRH analogs, and clomiphene citrate. This is basically this is a hormone which helps the ovaries grow and release eggs. Now these medications work better if your body mass index is 30 or less. That means below the obese range. If you are overweight, it's okay, but if you are in the obese range, then these medications also will not be able to help you out always. In some cases it does help, some it doesn't. So that's the point here. So lesser weight medications works better. So that's why losing weight is a key here. Now apart from these, sometimes for abnormal hair growth, some other medications like spironolactone or flutamide pills or some creams can also be given. Permanent hair removal options are also there, including electrolysis, laser hair removal. So you can go for these treatments as well, but these treatments are something which needs many settings and the treatment are sometimes very expensive. That's okay. So apart from all these, pelvic laparoscopy which was done to diagnose the problem, that time when we do a pelvic laparoscopy, we can intervene also. We can actually remove or alter the ovary so that we can treat the infertility or the symptoms which you are having. So but obviously this effect will be temporary, because if once your ovary wasn't able to pop out the egg, then obviously we have not removed the baseline reason. We have just removed some part of the ovary, or we have removed the ovary itself. So the problem has not been solved, just temporarily managed. So let's talk about the prognosis outcome. So with the treatment, women with PCOS are very often able to get pregnant, but there is an increased risk of miscarriage, high blood pressure, and gestational diabetes during pregnancy. So you have to take care of all these things as well. So what are the possible complications of PCOS? If PCOS is there, then you are likely to have infertility. You have more risk of developing endometrial cancers and a slightly increased risk of developing breast cancer. So that's why PCOS or polycystic ovaries, polycystic ovarian disease, polycystic ovarian syndrome, or sometimes it is also called as Steen-Leventhal syndrome, PCOS, PCOD, all these things are the alternative names of this condition. So you need to manage these conditions very promptly with the help of your gynecologist and reducing your risk factors, your obesity, your weight, and your diabetes, blood pressure, cholesterol, thyroid. So all these things are important to manage polycystic ovarian disease, and it is manageable, not a very big thing, not a very difficult thing to manage, but all you need to do is understand the problem and manage it very well, and do your hormone levels regularly so that you can track down how the levels are varying because of the treatment, and you can manage to live a healthy, long lives without complications. So that's all about polycystic ovary disease, guys. Hope you liked the video. Hope you have understood some part of it, perhaps all of it. So if you did understand, if you did like the video, then don't forget to subscribe my channel, guys. Don't forget to check out all the other videos which I have in my channel for you. And don't forget to share the videos. Ask your friends and family to subscribe as well. Till next time, I'm Dr. Paramjeet and you're watching Dr. Education. Stay connected, stay healthy.